Dengue, the outbreak. Dengue is transmitted by the bite of an Aedes aegypti mosquito, infected with any one of the 4 dengue viruses. It occurs in tropical and subtropical areas of the world. Symptoms appear 3 to 14 days after the infective bite. Dengue fever is a febrile illness that affects infants, young children, and adults. Symptoms range from a mild fever to incapacitating high fever, with severe headache, pain behind the eyes, muscle and joint pain, and rush. There are no specific antiviral medicines for dengue. It is important to maintain hydration. Dengue hemorrhagic fever is a potentially lethal complication affecting mainly children. Early clinical diagnosis and careful clinical management by experienced physicians and nurses increase survival of patients. 2 peak seasons for dengue has set in, according to the Department of Health. The first is during January, and the second peak is during the period between July and August. On the first 3 months of the year, dengue cases in the country reached 11,803 cases from January 1 to March 27. Department of Health said the number of dengue cases is 61% higher than the 7,335 cases recorded during the same period last year. Dr. Eric Tayag, head of the DOH National Epidemiology Center, said the El Niño phenomenon could have something to do with the increase in dengue cases.
On the first 3 months, masyadong mataas talaga ang bilang ng mga dengue cases. Dahil yan sa nararamdaman nating El Niño, ganito na ang nangyari way back in 1998 when the El Niño phenomenon was felt in the country.
As the rainy season comes in, the Department of Health has recorded 48% jump in dengue cases in the first 6 months of 2010 compared to the same period last year. Based on available data, DOH said 40,648 cases have been recorded between January 1 and July 30 of this year. Of the total number, 328 have died from the acute infectious disease. Cheryl Torres never thought that she already had dengue when she had high fever. She thought it was just an ordinary fever. But when she was brought to the hospital, she was surprised to find out her platelet count was already down to 15. The normal platelet count of a person is more than 200,000.
Akala ko simpleng lagnat lang, hindi ko alam na dengue na pala. Mahirap dahil pabalik-balik ang lagnat pag uminom ng gamot, sang oras lang babalik na naman.
Cheryl could not figure out where the dengue-carrying mosquito that bit her could have come from. Her daily routine involves just going from the house to the office and back.
Tayong mga Pilipino, binabaliwala lang pag may sakit. Mapalagnat, mapasipon. Dapat ugaliin nating magpatingin agad sa doktor pag may nakakaramdam tayo ng mga sintomas.
When someone has dengue, he or she will show the following symptoms as listed in the Department of Health's website. Sudden onset of high fever which may last 2 to 7 days. Joint and muscle pain. Pain behind the eyes. Weakness. Skin rushes. Nose bleeding when fever starts to subside. Abdominal pain. Vomiting of coffee-colored matter. Dark-colored stools. Those experiencing any of the symptoms are advised to seek immediate medical attention. To date, Quezon City has the most number of dengue cases based on the DOH monitoring. Central Visayas is second, followed by Calabarzon, Sorsogon, Eastern Visayas, and Davao. The ages of those who had dengue range from less than 1 month to 95 years old. A huge majority, or 77% of the cases, were 1 to 20 years old. The DOH is calling on the local government to help prevent the incidence of dengue cases in their respective areas.
Pag sinabing dengue-proof, di ibig sabihin mag-fogging. Tinataboy lang nito ang lamok, hindi sila namamatay. Gagastos lang kayo at makakasama pa sa kalusugan.
The Department of Health furthermore advises the public to clean their surroundings, including plants, gardens, and canals, and get rid of stagnant water that collect in tires and other containers. Here are the other preventive measures from the Department of Health, as shared in their website. Cover water drums and water pails at all times to prevent mosquitoes from breeding. Replace water in flower vases once a week. Clean all water containers once a week. Scrub the sides well to remove eggs of mosquitoes sticking to the sides. Clean gutters of leaves and debris so that rainwater will not collect as breeding places of mosquitoes. Old tires used as roof support should be punctured or cut to avoid accumulation of water. Collect and dispose all unusable tin cans, jars, bottles, and other items that can collect and hold water. With dengue cases on the rise, extra care is needed to keep surroundings clean and keep dengue-carrying mosquitoes at bay. Now, there are also new gadgets in the market which may help get rid of these pesky mosquitoes. One of this is the mosquito-repelling light bulb. It has the standard size of a light bulb, which makes it easy to install anywhere in the house. At only 9 watts, it is also an energy saver, so household can easily afford to keep this all on the whole night. Another product is the blue light insect killer bulb, which entices mosquitoes to come nearer than zaps them with electric current. There is also the electric-powered mosquito repeller gadget, which comes in liquid and matte forms. And when there's a brownout, the rechargeable electric fan with the mosquito repellent function can be very handy and useful. The gadgets may be on the expensive side, but can help families have peace of mind, especially at this time when it's dengue season. Currently, dengue is diagnosed within 5 to 7 days after the onset of fever. This has led to cases when dengue is already severe and the patient's life is in danger. Dr. Raul Destura of the Institute of Molecular Biology and Biotechnology at the University of the Philippines, Manila, National Institute of Health, is currently working on a project using technology to enable doctors to diagnose dengue within 1 or 2 days from the onset of fever. His project named Biotech M Project Dengue involves the use of nucleic acid amplification technology. In first world countries, it costs $8 to have such a test using that technology, but it costs $150 or 7,000 pesos in the Philippines. Destura believes the cost of the test has become high due to taxes and margins added by importers.
I guess ang isang problema dito ay regulation. Walang regulation sa industrial importation ng medical equipment. Mas malaki ang patong o profit ng importers. Only than monte sa taxes, kaya mapapamahal ito.
It will take 2 years before results can show if Destura's project can indeed make dengue diagnosis faster at a cheaper cost. If successful, the project can help lessen the anxiety of families who need to wait a long while at the hospital to confirm if a family member has dengue.
Kill 80s live before they become killers.